Yes, we do have shortage. And I think everybody discovered this in the last 2 years during COVID, that our healthcare system was brought to its maximum capacity by this pandemic. So we do need more hospital beds. We do need spare capacity because that's how you have a resilient healthcare system. Spare capacity in terms of physical space, equipment, but also staff, so that when we have surges in demand like what we've experienced, we can have a humane workplace environment for nurses and doctors to handle something like a pandemic. So the first thing is, yes, we need to train more doctors. We need to train more nurses. Some of it can be supplemented by immigration, but here are little footnotes on immigration. If we're taking trained doctors and nurses from other, especially developing countries, then they have those shortages too. So we have shortages on a global scale in terms of the needs. But that doesn't mean we can't provide the basic preventative healthcare services. I'll give you an example. The military is really pretty good at that. They take people who have no training whatsoever, and in a few months, they turn them into a medic that can save who can save lives in a conflict zone. Well, we don't have to do that for conflict zones, but we can do basic preventative healthcare access in every single community in this country. That is definitely within reach. We can do it within a couple of years. And there's pilot programs, there's examples, and it's very low cost. And the more you do on the preventative side, the less expensive and the less intervention you have to do as the side effects continue to build and as the illnesses get into more serious situation. In terms of logistical capabilities, as I said, we managed to ramp up logistical capabilities during World War II to win the war with pen and paper. I think our logistical capabilities are much more sophisticated than that today. But it requires tweaking the system and going after the real obstacles. For example, who controls the number of doctors that we train and graduate from medical schools in the United States? It's not the government. It's not even the market, right? It's the American Medical Association, right? It's a lobbying group. It's a cartel, essentially, that limits the number of doctors that we can graduate. So we have to untangle those obstacles, real obstacles that are designed to abuse the system. They force medical students into massive debt. They create artificial shortages, and they raise the cost of doing business and make those services exclusive for people who can't afford it or people who are willing to go into bankruptcy to pay for medical services. Those are real issues that we need to tackle. So it's not enough just to train more doctors and more nurses. It's about going after the abusive market power. And I think the wealthiest nation in the history of the universe, the most powerful nation in the history of the universe, should be able to do this and go after this abusive market power. By the way, we didn't have the New Deal of the 1930s without doing this hard work. We had to have PCORA investigations in Congress to go after the oligarchs of that generation and those who didn't want the federal government to have a New Deal program. We had to go after them. We had to go after the corrupt senators and representatives and Wall Street executives to get them out of the way so we can have the New Deal, so we can save the American economy at the time. We kind of have to do this today. We can't have a Green New Deal. We can't have a Medicare for all without a clean New Deal, cleaning the political system and the abusive market power in the economy.